Welcome back for another Radclusive video. Today, we're going to discuss the radiographic positioning of the wrist or the carpal bones. Before we proceed to this video, don't forget to click the like button, share to your friends, subscribe to Earlyseven YouTube channel, and click the bell icon for more Radclusive videos. The wrist has 8 carpal bones, which are fitted closely together and arranged in 2 horizontal rows, the proximal and distal rows. The carpals are classified as short bones and are composed largely of cancellous tissue with an outer layer of compact bony tissue. The proximal row is composed of the following carpal bones: the scaphoid, lunate, triquetrum, and pisiform. The distal row, on the other hand, are composed of trapezium, trapezoid, capitate, and hamate. There are different positions, projections, and methods used for the X-ray examination of the wrist. These are the PA projection, lateral position, ulnar deviation, PA radial deviation, and PA axial or the Stetcher's method. For the PA projection of the wrist, seat the patient low enough to place the axilla in contact with the table, or elevate the limb to shoulder level on a suitable support. Have the patient rest the forearm on the table and center the wrist to the image receptor area. The central ray should be directed perpendicular to the midcarpal area. The structures to be shown for the PA projection of the wrist are the following: a PA projection of the carpals, distal radius and ulna, and proximal metacarpals. The PA projection gives a slightly oblique rotation to the ulna. The lateral position of the wrist, on the other hand, is used to assess the relationship of capitate, lunate, and distal radius. It is also used to rule out anterior and posterior fractures. For the lateral position or lateromedial position of the wrist, have the patient flex the elbow 90 degrees to rotate the ulna to the lateral position. The central ray should be directed perpendicular to the wrist joint. Structures to be shown for the lateral position of the wrist are the following: a lateral projection of the proximal metacarpals, carpals, and distal radius and ulna. Distal radius and ulna, carpals, and proximal half of metacarpals should be also visible. The distal radius and ulna and metacarpals are superimposed. The next position is the PA projection of the wrist with ulnar deviation. This position is used to open spaces between adjacent carpals. For the ulnar deviation of the wrist, seat the patient at the end of the radiographic table with the arm and forearm resting on the table. Position the wrist on the image receptor for a PA projection. With one hand cupped over the joint to hold it in position, move the elbow away from the patient's body, and then turn the hand outward until the wrist is in extreme ulnar deviation. The central ray is directed perpendicular to scaphoid. For the structures shown, this position corrects foreshortening of the scaphoid, which occurs with the perpendicular central ray. It also opens the spaces between the adjacent carpals. The radial deviation is used to visualize open spaces between carpal and medial side of the wrist. For this examination, position the wrist on the image receptor for a PA projection. Cup one hand over the wrist joint to hold it in position. Then move the elbow toward the patient's body and turn the hand medially until the wrist is in extreme radial deviation. The central ray should be directed perpendicular to the midcarpal area. Structures shown for radial deviation opens the inner spaces between the carpals on the medial side of the wrist. For the PA axial projection, or Stetcher's method, seat the patient at the end of the radiographic table with the arm and axilla in contact with the table. Place one end of the image receptor on a support and adjust the IR so that the finger end of the image receptor is elevated 20 degrees. Adjust the wrist on the image receptor for a PA projection and center the wrist to the image receptor. The central ray is directed perpendicular to the scaphoid. The following structures should be visualized for the Stetcher's method. The 20-degree angulation of the wrist places the scaphoid at right angles to the central ray so that it is projected without self-superimposition. No rotation of carpals, metacarpals, radius, or ulna. In the distal radius and ulna, carpals, and proximal half of the metacarpals should be clearly visualized. That concludes our video for the radiographic positioning or X-ray of the wrist. If you enjoy watching this video, Don't forget to click the like button, share to your friends, subscribe to Earlyseven YouTube channel, and click the bell icon for more radclusive videos.